Every year on 15th February, we celebrate the International Childhood Cancer Day. This day is very important because it is there to spread awareness about childhood cancers. It is there to tell everybody that childhood cancers are very curable, and if proper treatment is given at the right time, most children lead a very happy and healthy life in future. Children usually suffer from different types of cancers as compared to adults. The most common types of cancers in children are leukemias, that is the blood cancers, the most common ones being acute lymphoblastic leukemia and acute myeloid leukemia. This leukemia alone constitutes around 25% of all childhood cancers. The other types of cancers which a child or the children usually have are in brain. They can have gliomas, they can have ependymomas, they can have eye tumors like retinoblastomas, they can have medulloblastomas. Then they can have tumors in the abdomen region which can be neuroblastomas. They can be arising from the kidney, which is known as Wilms tumor. They can be arising from the soft tissues like muscles and bones, which can be sarcomas and rhabdomyosarcomas. The important thing we should know about children cancer is that they are very, very responsive to treatment, and generally the outcomes are better as compared to the adult cancers. Not only the spectrum of cancers is different in children, but the availability and usage of treatment is also very different as compared to adults. Although we do use all the armamentarium which we have, we can use surgery, we use immunotherapy, chemotherapy, radiation therapy, but the protocols which are followed in childhood cancers are very specific and very different. Whenever we choose a hospital where we should get a child treated, we should keep in mind that the hospital should have a multidisciplinary tumor board in which there should be a surgical oncologist, a pediatrician, a pediatric oncologist, a radiation oncologist, and a medical oncologist. This apart from the diagnostic physicians like nuclear medicine specialists, pathologists, and radiologists. Childhood cancers can have different outcomes and different side effects. The side effects in children are pretty different because they'll have development side effects, they'll have hormone side effects, they can have cognitive impairment, while in adults these kind of side effects are not observed. Since many children, around 70 to 80% children, usually have a long and healthy life after proper treatment, so keeping in mind that they should not have these kind of side effects while we are treating the child is pretty important. Childhood cancers, again, as I said earlier also, they are very curable, and with proper treatment all children will lead, many of them at least, if not all, they will have a very happy and healthy life.